So basically, welcome to you guys. We're glad you're here today. We're going to go ahead and let Ms. Batson, the administrative assistant, speak to you about Castle Branch and immunization, CPR, and all that kind of stuff. And then once Dr. Pfeiffer gets here, we'll do your welcome and everything. Okay? Thank you, guys.
Okay, so I'm Tracy Batson, administrative assistant in the nursing department, and you actually received this PowerPoint from me whenever I sent you the codes for Castle Branch, okay? So, but here's my contact information again. And then I sent you out with this PowerPoint 3 package codes. One's for, let me just go through this. I get ahead of myself sometimes, so excuse me if I do that. You'll be emailed 3 package codes for Stage 3 requirements. Please complete all the requirements in Stage 3 in order to come into the program. I can't stress how important this is. So everything, in your background, your drug screening, which was to be done between the 28th and 12th of July, and your uploads into your regular portal in Castle Branch, and also the Castle Branch bridges. All these 3 things have to be completed, and the deadlines and timeframes that we have set for you in order for you to come into the program, okay? If your immunizations and things like that are not complete by July the 30th, you will lose your seat in the program, so it's very, very important, okay? You must use all the codes to receive all the requirements. The SQO4 is the background and drug screening code, which costs you $98.75, and I think most of you have already gone on and paid for this, as far as I know. When you enter this code, please click on all the clinical sites listed to review your information, because we do not know where you're going to be going at this time to clinical, okay? Does anybody have any questions about that? I did have a few students to email me after Tuesday and say that they did not click on all the clinical sites. But if you don't, then those clinical sites won't be able to review your information, and we have to send that out to all of them. So if you get out of here later or whatever and think that you haven't clicked on all of them, shoot me an email, and I can go in there and fix it for you, okay? It's not a problem, but what happens is if we send it out and you didn't share your information, like with First Health or somebody, then they won't be able to see your documents, okay? You have to share that with them, okay? Any questions on that? Okay. Please use your student email, which I'm pretty sure most of you probably did. Not only are you going to get information about Castle Branch from them, but also you'll get it from the school as well. Your faculty members, me, of course I think most of you, we had to use your school email whenever you did Stage 2. So that's how I get your email, put it into my system, okay? In the upper right-hand corner, you're going to enter the code SQO4. Once you open the account, you're going to pay the $98.75. Your background will get automatically electronically uploaded into Castle Branch, okay? But for the drug screen, you'll receive a custody or control form to take with you to the site that performs your drug screening. This form allows the site to upload your results electronically, and it also shows that you've already paid for the drug screen, so you don't have to pay through them again, okay? If you do not receive this form within 24 to 48 hours, you will need to contact Castle Branch and let them know. Has everybody in here pretty much received their form?
Do they email it to you, or is it through your account?
They usually email it to you. Mm-hmm. And if they don't within the 48-hour time frame, you'll want to give them a call, okay? You will complete your drug screen between the dates of June 28th and July the 12th. Don't perform this drug screen any other time, okay? Because if you do not do it between those 2 weeks, then you may have to redo it, which will cost you extra money in the long run. We do this is clinical site specific dates as to when they want this done. All these requirements are the clinical site requirements, not Sandhills, okay? Next screen. Click here. Okay, I also sent out a attachment with the Quest sites that you can use for your drug screening. You must have placed the order with Castle Branch for the $98.75. You must have your form, your Castle Branch custody or control form, and you must use the Quest sites emailed to you, even if CB states another site. And you'll need to take your ID with you to the drug screening facility. In other words, what I'm saying here is sometimes they'll put somewhere like Benson, South Carolina, or Charlotte, North Carolina, on your form as to where to go to get your drug screening, you do not have to go to that place. You can go to any of the ones on the list that I sent out, Quest facilities, okay? Any questions on that? I had a couple of students say, email me and let me know. They're sending them to Charlotte, but sending them to Benson. Can we still use that, the ones I sent? I said, yes, you can, okay? Okay, now this code is the SN96. That SC stands for second consideration. There's no additional charge for this account. You're going to put it in the upper right-hand corner. There, it's where you're going to upload your immunizations and your other uploads, like first health orientation, things like that. You'll have a to-do list for this account, and you're going to complete all the things on your to-do list except for the flu vaccine, okay? It will be due during the current flu season, which will not probably be until September, October. Usually by the end of October, we have you go ahead and put that in there. And there's a different deadline on your account for that. That's why it says October 31st, I think, is your deadline on that. So don't do anything with the flu shot, nothing at all. Don't even answer and say, I'm going to get it done later, or because when you do go in to actually put it in, when faculty lets you know it's time, it's going to ask you, are you going to get your flu shot? You're going to click on yes, and then it takes them maybe 1 to 2 days to put a place in there for you to upload that documentation. So don't get antsy about it. They will put it in there once you click on there that you're going to get the flu shot, which we require. Okay, now this is the third code. And I will say this is a new code to all of us. This is a first health code that they have started this semester. And the cost of it is $10. And it's called Castle Branch Bridges. So you're going to put this package code in just like you do the other ones, and they'll charge you the $10, and you'll have a to-do list on it. Sorry. You'll have a to-do list on it just like you do on the other portal, and you have to complete all the requirements, which right now there's only 4 things supposedly in there. It's supposed to be your background and drug screening, which once you open this account, it will transfer your background and drug screening into this account from your other one. Does that make sense? In other words, you won't have to pay for the background and drug screening again. It's just the $10 to get into the Bridges account. The $10 is for them to be able to review your documentation that they've required, and eventually we're going to have our clinical schedules in there. That hasn't happened yet. It may happen with you or may not. We're not sure yet. They just threw this code on us a couple of weeks ago. So just make sure that you go in and pay for that code. And if for some reason you don't see a to-do list in there, don't worry. I'll try to reach out to y'all because I've already had a couple of students email me and say that they don't see a to-do list on this account. There's only supposed to be a couple of things. The orientation, you'll have to do it again, even though you've already done in the portal. And COVID-19 attestation will be in there as well. So only thing really you've got to do is those 2 things, since your background and drugs are going to automatically import over, okay? Any questions on that? Immunizations and screenings. The CDC website. This is where you can go and look at your childhood and or adult series of vaccinations, okay? There is a difference in what you got as a child and what you get as an adult. If you have your vaccines as a child, that's what you'll normally use. But if for some reason you don't and you have to start a new vaccine, this is a good place to go to look at those to see what the requirements are as an adult, okay? You're not considered a child anymore. So, although you can use some of those vaccines from being a child, okay? The Tdap is required. It is actually, the Tdap is a 10-year, every 10-year vaccine, okay? If you have not had that in the last 10 years, you're going to need to get that, okay? But we also require that you upload your primary series, which is something that most people get as a child, okay? If you, for some reason, you can't find it or don't have it, of course, you'll need to go ahead and get possibly the Tdap and the other 2 vaccines that go along with it as an adult. Any questions on that? Varicella is required. You can have 2 vaccines, or you can get a positive titer with the lab report. Just be sure that if you do the titer, that you do put the lab report in Castle Branch with that titer. Same thing for MMR. You can get the vaccines, or you can do a lab report with the, the titer with the lab report along with it. The Hep B. Most people have had that, but if for some reason you haven't, we do require that you get that. But what you will do right now is you'll go into Castle Branch and you'll sign the declination waiver and upload it into Castle Branch. Then you'll go and start your series, your Hep B series, which takes a certain amount of time to get that. But as long as you're in the series, when you come into the program, you are okay to come on in. Does that make sense? So we do require that you get that though. So once you get it, you're going to call Castle Branch back and tell them you want them to clear your upload space so that you can upload that Hep B vaccination. Okay, that's 3 shots. Okay, the TB screening. You're going to go have a TB skin test done. You're going to go back within 48 to 72 hours later and have it read. So don't do it on the day where you can't go back to the facility where you had it done within that time frame. That's what this is saying. Don't have it done on Thursday or Friday, and you cannot get it read over the weekend. Start finding your immunizations now. You can get them in different places. You can get them from the health department. You may have a little card that the health department's given you, as long as it's got your name on it and it has somebody that signed off on the vaccinations that you had. You can just upload a picture of that card. Some people have to go back to their high school to get their immunization records. They do keep a copy of those, I think, forever. I've gotten a copy of mine not too long ago, and trust me, I've been graduated a long time. So most high schools keep those records on file. Your medical office, etc., wherever you can go to get those. If you don't, when you go to your medical office, you can ask them to give you a state registry listing of your vaccines. They should have a list of any vaccines that you've gotten in North Carolina. Okay, if you got it from different states, you might have to go back to that doctor's office in the other state where you had it done. Like if it's South Carolina, and tell them you want a state registry listing of your vaccines from South Carolina, and that way you've got them all together. Okay. Nothing needed with the flu shot. If you don't have any records at all, you need to see your healthcare provider as soon as possible to start the series of immunizations required as an adult, okay? And the CDC website, you can just click on in this PowerPoint, it'll take you right there, okay? You don't have to go in and put it into your browser or anything. Nothing with the flu shot. Mark your calendar for when you need to update your TB skin test annually. This is actually a copy of what you are going to need, and it tells you how many vaccinations and or a titer with a lab report. Same thing with this that I just went over. These are summary dates for your late consideration. The drug test needs to be between June 28th and July 12th. You're supposed to register with Castle Branch, what I think most of you have, by the 28th of June. Please do not perform your drug screening prior to, did I go over this already? July 30th is the requirement for all the other documentation. Okay, that's your deadline for everything except for your background and drug screening. So, questions?
So for the CPR and the nurse aid documents, I work as a nurse aide, so I just need to go on the state registry and do like a screenshot and upload that?
No, everybody in here will have to upload their certificate of completion for your NA1 course. If you don't have it or can't find it, you need to get in touch with wherever you got that CNA1 certification and let them know that you need a copy of something to upload. Preferably the certificate, but I think we have let students, like if they took it in high school or somewhere else, upload their curriculum schedule and the grades they got in the courses. Can you get yours?
I should be able to.
Okay. Anybody else have that issue? No. Okay. So, and here's another thing. If you got your certificate of completion prior to June 1st, 2019, then you have to have that along with your registry listing. But if you got it after June 1st, 2019, all you have to do is upload your certificate of completion. okay? You have to upload both things together if you're required to upload both things in order for them to see it. In other words, you can't put one in and then later come back and put another one in. Anything that you upload into Castle Branch, if you have additional information that needs to be put in, they're gonna wash out everything that you had in there before. They're gonna reject it. It's not gonna be there anymore. So they only look at what you upload each time. So if you had another piece of paper that needed to go with something else, then you would need to upload that piece of paper again, plus what the additional items that you needed. Does that make sense? And that's with any of these requirements. They cannot see it after they reject it. It washes out of your account completely. I will say, I cannot see your background and drug screening results, okay? Sand Hills is not able to see those. That's a clinical requirement, and they can see your documentation, but we cannot. All we can see is a check mark saying you did it. The immunizations parts, in order for me to be able to help students to get what they need, because sometimes if you call Castle Branch, you may get somebody who just started, or they have different excuses for that, but you may have to contact me. I can pull up what you've uploaded and tell you exactly what you need. So don't hesitate to call or email me if you have problems getting things into Castle Branch. Now, the Castle Branch Bridges, I will say again, is a new depository for us, so I may have questions for them before I can answer you, but I will get back with you on it. Any questions as far as?
So to put in the nurse aid requirement, I don't have a spot for it. I already put in all those codes and those are all.
For what now? I'm sorry.
To put in the certificate of doing the nurse aid work. I don't know where to
You don't know it where, you might have to call them. Yours may be the one I looked at the other day, because I go in and I'm the one that approves your NA1 thing. That's the only thing I do. Castle Branch does all the rest of it. And I saw where there was a pending, but there was no documentation in there.
Okay.
I don't know if it was yours or not, because I don't really know y'all by name yet.
Any spot for it right now.
So call Castle Branch and let them know that you're missing a spot to upload.
Okay.
Any more questions as far as, okay.
What if, like, TV skin test, you just do it again? Even if you have one that's
If it's not been in the last 6 months, you will need to do it again, okay? And that will last you a full year, because it's only, has to be updated annually. If for some reason you've had a positive TB skin test, there are directions in Castle Branch as to what you'll need to upload. It's usually a chest x-ray or a questionnaire or something like that, so. Let's say you've had an x-ray done like 2 years ago because you had a positive TB skin test. All you would need to upload is that documentation along with a questionnaire. Okay, so you do have to have something in addition to. Don't mean you have to go back and have a chest x-ray. They don't advise that you do that every year. So what we do is after you've had a, what'd I just say, blood test, you would need to do the questionnaire every year.
To piggyback on some of the things that Ms. Batson's kind of discussed with you guys, she said that we can't see your drug screen and your background check, and that's true for all of us guys, okay? Those are clinical requirements for the clinical agency. So you guys remember how you have HIPAA for your patients to where you're not supposed to share patient information? This relates to FERPA, to where we're not supposed to share student information. Do y'all see where I'm going? So we don't have access to any of that stuff. Whenever it goes in, it ends up going straight to the clinical agency and they review that stuff, okay? So you don't have to worry about any of those kind of things.
And I will say this account, once you open it up, even though it costs quite a bit of money, it will be there for you for the life of the company. So as long as the company is open, you can go in there, like if you're going to get a new job and you need immunizations, all that stuff will still be in your account where you can just print it off. So it's very helpful. I've had students tell me it's been very helpful for them.
And a couple of other clarifications. She had told you that your TB test is due annually. So you'll want to make sure you make a note of when you have that TB test, and it'll be in your account, so you'll be able to go and see it. And if I'm not mistaken, that
They'll send you an email.
They send emails that say it's coming up, but you still want to keep up with it. And then your CPR is good for 2 years. So you need to be doing the same thing with both of those. You need to keep up with when those things are due. Because just like as an employee of the hospital, if my TB expires or my CPR expires, I don't go to work, guys. Too bad, so sad. I stay home, I don't get paid, okay? So we're trying to kind of socialize you into the world of nursing. So what happens with you guys if they expire? You can't go to clinical and you're likely to get an unsatisfactory. So it's important, because you can potentially have TB and expose patients to it. Or if you're not up on your CPR, we can't prove you're proficient. And then if you have to perform that on somebody, do y'all kind of see where I'm going? The other thing I did want to bring up to you, I have questions about this usually every time about the COVID vaccine. Right now, it is not currently required, okay? So it's highly recommended, but I just wanted to answer that for you. If anything changes with that, we would be, the ones who would be communicating with you guys, okay? Do you guys have any other questions for Ms. Batson in regards to immunizations, CPR, the CNA, how to upload these things, any of that kind of stuff? And before we get to your question, I do want to bring up to you guys, if you have questions about that kind of stuff, Ms. Batson is always who you want to address your questions to, okay? Because she handles, Castle Branch, she handles that Bridges stuff, which is new, she handles the CPR, the immunizations, the drug screen background check, all of that stuff. So you want to get it to the right person, because if you send it to me, and I'm Heather Cox, because I know there were some folks who came in just a smidge late, I'm your NUR 111 course coordinator. If you send that to me, I'm going to send it to her. And if I'm tied up in lab or something, it might take all day, and you want to get your
Whereas
answer
I'm
pretty
sitting
quickly.
there and I can see your email come through, okay?
Yeah, so I just wanted to reiterate that to you. You had a question for Ms. Batson?
Yes, for the TB test, will we have to re-upload that for the following summer?
Once a year, okay? So whenever yours is getting ready to go out, you'll need to get that. And they won't open up that space for you to put that renewal in till about 3 to 4 weeks before it's due. So if you get it done a month early, you might have to wait a little bit for them to open up the spot, but they're going to shoot you an email and say it's due at this date, and then like a couple weeks later they will clear out the upload spot so that you can upload again. Just once annually, okay?
All right, any other questions for Ms. Batson about any of this stuff that we've talked about so far?
Has everybody got their CPR already? Anybody that hasn't?
Mine, I have my certification right now, but it runs out this December, so I'm gonna do one of the ones that was on your list.
Okay,
Is that fine, and just upload it? Mine's July 10th, just upload it after that.
that's correct. Mm-hmm.
And are you already scheduled for one as well? Good, okay.
Okay.
All right.
Yes, and if for some reason you don't get your card between that time and the 30th, email me and let me know, and I can check with Continuing Ed to make sure that you've done it. And then as soon as you get your card, you'll upload it. Any more questions? Okay. Well, don't hesitate to call or email if you do have, additional questions once you get in there and start maneuvering in Castle Branch.
Okay.
It's great to see you here. We're glad to welcome you. We're glad that you were offered a seat in late consideration. We feel like by having you come to campus and be able to answer your questions, it helps make things easier for you for the long run, and get prepared to be with us in August. So congratulations on your acceptance. My name is Lynn Pfeiffer. I'm the department chair for nursing, so I have the nurse aide, ADM program, and therapeutic massage program that I'm responsible for. My office, though, is in Kennedy Hall, 122. Ms. Cox and I are directly across from each other, so we know each other very well, and we ask each other questions every day. So we're right there together, and Ms. Batson's right around the corner. Yesterday, I couldn't even recite her telephone number because I just say Tracy, and she's right there. So if you don't get Ms. Cox, you don't get me, you get Ms. Batson. She's here all the time. Our email addresses are last name, first initials, sandhills.edu. So I'm Pfeiffer L at sandhills.edu. We are an associate degree nursing program. Of course, that prepares our graduates to be ready to take the NCLEX-RN. NCLEX stands for the National Council Licensure Examination for Registered Nurses. So you will hear us talk about NCLEX because that's kind of an end-of-program outcome. We want our graduates to complete the program and pass their NCLEX exam so they can be licensed registered nurses. The majority of our students, of course, do get licensed in North Carolina. We do have some military spouses or other folks that move to other states and get licensure in other states, but the majority in North Carolina. If you want to know within North Carolina the difference between an RN and LPN, there's a lot about scope of practice, which is determined by law, that you can read on the North Carolina Board of Nursing website. So that is state by state, but you can go to the North Carolina Board of Nursing and read about that, so you kind of know a little bit about the difference between a licensed practical nurse and a registered nurse. There's information there that's consumer information, which you as a consumer, as a student, you can read about our NCLEX pass rates there. And I never want to brag on pass rates, but we do well. Our students do well, our graduates do well. So we're above the national average, we're above the state average for our pass rates. And that's where we want to be. We aim for everyone to pass the first time they attempt. That's what's reported on the Board of Nursing website, is first attempt at passing licensure exam. So that's our aim, but we also know sometimes people have a bad day and they don't pass the first time around. So those results are there for you to see. I think last year we were right at 97, 98%, something like that. So we've been above 90 most every year in recent history. We are accredited, Sandhills is accredited by the Southern Association of Colleges and Schools. So we have a SACS accreditation. And then the nursing program itself has a program through the National League of Nursing Commission for Nursing Accreditation with CNEA. It's abbreviation. It is a national accreditation for nursing programs. They accredit LPN through doctoral level nursing programs. So you can read about CNEA if you're curious about what their standards are. We just recently received that accreditation, and our aim is to keep it and continue to improve as a program. They look at things like pass rates, they look at your retention rates, they look at your faculty certifications, credentials, they look at our student outcomes, they look at employer satisfaction, they look at a lot of information about a nursing program. And of course, they're looking for a quality curriculum so that your graduates are among the best that graduate from an RN program. And that's why we're really glad to have accomplished that. We have approval from the North Carolina Board of Nursing to offer a nursing program here on our campus. The Board of Nursing is involved with protecting the public. They want to make sure that our curriculum is sound so that when you do graduate and you receive licensure as a registered nurse, that you're a safe entry-level practitioner, because they want to protect the public from somebody who's not. That's why the Board of Nursing is involved. They're not really there specifically for nurses, they're there for the public who are cared for by nurses. The answer to this question, can you take the licensure exam to become an RN when you complete your ADN? Yes. It's interesting about that question because people will say, well, do you have to not get your baccalaureate? The answer is no. ADN graduates and BSN graduates take the same licensure exam for entry-level practice. So that could change at some point in time, but right now an ADN can sit for licensure. Can you get a job anywhere in the United States after you graduate from Sandhills? Major employers in North Carolina hire SEC graduates. Anywhere in the United States? I don't know. There are some areas throughout the country where they do tend to hire baccalaureate nurses as opposed to ADN graduates. Certain specialty areas want to go ahead and hire BSN graduates, but as far as I know, our graduates don't have any trouble finding a job, no matter where they move to. But we do prepare our graduates for entry-level practice. First Health of the Carolinas does want our graduates, any graduate from an associate degree program, to get their baccalaureate within 5 years. everything that we require that you take in our curriculum transfers to the UNC system for RN to BSN. So we're designed that way so that everything that we require goes onto that program and you can get your baccalaureate. Depending on how much you've done already with your coursework, you may be able to get it in as little as a year, or it may take 2, depending on how many general education courses you still need. They require a few more general education courses than we do. For instance, a baccalaureate program usually requires a statistics course. We don't require that in our program. So just be aware, ours is designed through an articulation agreement so that everything goes so that you can get your baccalaureate degree. There are programs in North Carolina that are RN to MSN programs. I know that UNC Chapel Hill has one, UNC Pembroke has one. So those programs are definitely out there. So you'll hear all of us talk about, you might want to work on BSN courses, so if you have time in your schedule to do that. In terms of applying for financial aid, if you haven't done that, we definitely recommend that you do that. Sandhills has scholarships. If it's probably late now to do that, but if you haven't done it, do it. You never know. Sometimes people change their mind and don't come in the program, and then their scholarship becomes available again. So if you haven't done it for this year, you can go ahead and do it, and then be sure and do it for the next academic year as well. We do have programs with UNCP called the Ribbon Program. Anybody here a Ribbon student? Okay. And we also, the majority of our graduates do the RN to BSN track. Any questions for me about progression, articulation, program in general? Ms. Cox has the information about the course, specific to the course, information that you've already been sent, but she also is going to talk with you about registration for course and answer questions. So once again, welcome. We're in Kennedy Hall until we're in the new building. And you may get to be in the new building, we hope. That's projected end of fall 2022, maybe January 2023 would actually be in the new building. It will be primarily nursing and EMS in the new building. So we're looking forward to that change as well. Thank you.
All right, and so just a couple of quick things here. You guys, since Dr. Pfeiffer was talking to you about the BSN degree, you guys have probably looked on self-service and seen that you guys are currently under the associate degree, general education and nursing. Have y'all seen that, the AGEN degree? And what they do is they put you in that before you actually enter the program. And that way when you're taking those other courses, if you end up taking courses besides just what you need for the associate degree nursing, then your financial aid can potentially pay for it. If you're in promise, all that kind of stuff, okay? So when you go on self-service and you look on there, it looks like you've got a lot of courses left to do, right? Those are courses that can go like towards your bachelor's degree, but it also includes the things that we have on the program sheet for the associate degree in nursing, okay? So I had a student who asked me that on Tuesday, so I just wanted to discuss that. So you're currently in AGEN, okay, and you will be flipped to associate degree in nursing once you actually enter into the program. And they do that over there in the front office. It's not anything you guys have to do anything with, okay? Does that kind of clear that up a little bit? Because I had a student who asked that question the other day. So if you are still taking courses, you know, towards your bachelor's while you're doing the nursing courses, that's okay. We usually recommend not doing anything else besides nursing if you can get away with it, but if you feel comfortable with it or if you're needing to do it for your financial aid, because you guys know 12 hours is full time, right? My course, Nursing 111, is actually only an 8-hour course, okay? And so sometimes people do have to take extra courses with it. Or they have to take extra courses because they haven't already completed them. And I'm going to go over that in just a minute, okay? I just wanted to answer that question before I forgot. So just to introduce myself, I kind of introduced myself as you were coming in, but for the camera since we're recording it, my name is Heather Cox and I'm the coordinator for Nursing 111, okay? And I'll pull up my information here in just a little bit. I'll probably write it on the board here for you guys to be able to see it as well if you need to get in touch with me. The two speakers that you already had, Dr. Pfeiffer is our department chair, And the PowerPoint that she just went through, you guys had already received it by email, right, from Ms. Batson previously? Okay, so you've got that for reference. The email, the PowerPoint that Ms. Batson went over as far as had her contact information, it went over immunizations and all that, she sent that out a while ago too, right? All of you guys received it sounded like, because you guys were asking questions and all that. I'm going to go over the CNA PowerPoint here real quick, and you had received it already. I think she sent it out at the same time. Whenever we get done with the recording and Mr. Waldrop gets it loaded for us and all that stuff, we'll send these PowerPoints back out with the recording, okay? So just so that it's there if you need it, okay? Any questions about anything so far that we've discussed? Everybody's doing okay. All right. So I'm going to go over this CNA PowerPoint real quick, and then we'll probably take a quick break and we'll come back in and get into NUR 111 stuff, okay? So you guys had already received this PowerPoint, I think you said, whenever Ms. Batson sent out hers about the immunizations and stuff. So hopefully all of you guys are already in a CNA program. You've already taken a CNA program. Is that true for everybody in here? Okay, because that's what Ms. Batson was talking about. And when we get to the program sheet, because I'm going to go over that next when we come back from break, it lists on there, if you have taken your CNA after June 1st, 2019, then all you need is your certificate of completion from a state-approved program. And that's what you'll upload to Castle Branch, right? If you took the CNA course prior to June 1st, 2019, you'll still need your certificate of completion or some type of document. So if they can't get that for you, you'll want to talk to Ms. Batson.
I think that we were given our certificate.
Excellent. So you'll need that, but if you took it before June 1st, 2019, you'll also need proof that you're on the registry. So when you were talking about going to the website, that's what you'd have. And I think she said if you have multiple documents to upload, you have to upload them like at the same time. Yeah, okay. But if anybody has any questions about the CNA course or any of that kind of stuff, Ms. Powell is our CNA person here on campus. So let's say you have difficulty finding a certificate of completion or getting up with somebody from your program, then you can always call her and she can try to help you, okay? All right, so just kind of flipping through this real quick. We just talked about this as far as, you know, just a certificate of completion versus a certificate of completion and being on the registry. We already talked about, this is the next part. Okay, so you guys will already be CNA 1s, at least having a certificate of completion when you come in, day 1. And our first day of class is August 16th, okay? So we don't have lab the first week, okay, when you come into 111. We will have lab the second week. And during that second week, what we do in lab is validation of CNA 1 skills. Did you guys hear me say that? And we're going to go through that calendar in just a little bit too, okay? So the stuff we validate, we do discuss confidentiality again. HIPAA, you're going to get that in class, clinical lab, I mean forever, it never goes away, of course. We'll validate hand washing and then vital sign accuracy. And for vital signs, we don't usually mess with temperatures, but we do validate blood pressure, pulse, and respirations, okay? So you'll have probably some check sheets that I'll email to you guys later on towards the end of July, so you can go back and kind of refresh on that. But when you guys learn how to do your blood pressure in your CNA program, how were you guys taught? They didn't tell you to just blow up to 200 and let it come down, did they? I hope not. Did they tell you to ask the patient what their blood pressure normally runs and go 30 over that for systolic? Y'all are looking at me. I hope we didn't learn it that way either. Okay, did any of you guys do the palpation method, to where you inflate the cuff and you palpate here at the pulse, either here or here, and then whenever the pulse disappears, when you inflate, then that's when you go 30 over that number. Is that how you guys learned? Y'all are looking at me. Do y'all remember? Haven't done blood pressure in a while. Too busy doing them on the electronic machines? Probably so. Okay. So anyway, I'll send those sheets back out, okay, and they'll be our own sheets, and that'll be what you'll be kind of responsible for when you come in that week. If for some reason after you've practiced at home and you're in that second week and you're not doing real well with your skills, they'll just have you come back and practice, okay? Did everybody hear me say that? But you don't want to walk in and not know nothing from nothing. Y'all kind of see where I'm going, because we have to be able to move along. That's one of the reasons they have you do CNA before you even come into the course, because we don't have time to go back. Y'all know what I'm saying, and reteach other stuff, okay? All right, and then she discussed your CPR. Please make sure that your CPR is this heart code, basic life support CPR AED. It has to be American Heart Association. We do not accept Red Cross, okay? And it has to be this one. It's real specific, okay? So if you have any questions about CPR, who are you supposed to send your email to? Miss Batson, thank you, not me. I'll forward it to her if you do that, but you'll get a quicker answer getting it to the right person, okay? And the CPR goes along with the immunizations, and those have to be completed by when? What does it say here? July 30th, that's exactly right. Your drug screen is between what dates? June 28th to July the 12th. She told you not to do it too early, right? Because you might have to go back and do it. But you also don't want to do it too late, because it may be that the decision is that you can't enter the program. Did you guys hear me say that? We've done that before, okay? Because you didn't meet the deadlines. And when you come into the program, deadlines are real important, guys, okay? It's just like I said for the hospital. You know, if I don't meet my deadline for my TB test or my CPR or whatever, you know, they don't let you come to work, okay? All right, we already talked about CPR being good for 2 years. There is information in there about how to go about registering for CPR, and there were some class days and times, but it sounded like you guys were already either signed up or familiar with this or had it or whatever, okay? Any questions about this PowerPoint that we just went over? Questions about CPR, CNA, any of that kind of stuff? You guys are good. All right, well, tell me how you learned it. Don't want to tell me, okay? So I want you to practice it the appropriate way. So after I confer with Miss Stansel, she's the one who's going to be leading our lab starting this fall, because our other lab person had retired this year, okay? So as soon as I confer with her, I'll try to send the sheets out earlier. Would that be helpful? Looks like a lot of y'all would think that. Okay, all right. So we'll do that, okay? And then what I'd recommend, you guys know, we sent out your uniform sheets, right? Everybody got that email? Because I had a girl in the last information session told me she didn't get it. Okay, so it says on there you have to have a blood pressure cuff, you have to have a stethoscope, you have to have, you know, certain things. Doesn't matter the color of the stethoscope, the blood pressure cuff, any of that kind of stuff, right? But you want to go ahead and get that equipment, and then you can be practicing on, if you got buddies who are coming in here, people at the house, you know what I'm saying. I'd recommend practicing on adults, not children, because you guys know that children's heart rates tend to be higher, right, depending on the age, and their blood pressure tends to be lower, right? And if you're not aware of that, you'll learn it pretty quick, because we cover it right there in the first week of class. But you'll want an adult, because that's probably who you're going to be checking it on whenever we do the practice, okay? But I will. As soon as she tells me we're okay, I'll send them out. That sound good? It probably won't be me sending it out. Who will be sending it? Miss Batson, but it'll come from me, okay? So I mentioned this earlier, but I don't remember if I mentioned it on the camera. Make sure whenever you look at who the email is coming from, it will most likely come from Miss Batson up until you enter class, because she has all your emails in like a big repository. But make sure who it's truly coming from and who we ask you to respond to, okay? Because it'll probably be from her, and if you hit reply, who's it going to go back to? Her, instead of coming to me if it's from me, okay? All right, so the next thing I'm going to cover is the program sheet here, okay? And we've already spoken about some of the pieces and parts of it. You guys are probably pretty familiar with it, because it was probably like your Bible to get in here, right? Yeah, that's what I figured. So you're probably very familiar with Miss Donadio, because she helped you with stage 1 documentation, and then potentially with Miss Powell if you've done your CNA here on campus. Certainly, you're definitely done with stage 1 and stage 2. So we're down here into stage 3, which is your conditional admission, right? Which means you've got a seat, it's not going anywhere as long as you do all these things we're talking about today, basically, right? Okay. So it just comes back through. It does say something about a nursing orientation in July, okay? The reason this is saying July 2022 is because they've already uploaded the program sheet for the next year. Do y'all see what I'm saying? So you guys are still for July 2021, obviously, okay? But they've uploaded the new one. So we will be having probably an orientation in July. It will be, again, optional, okay? And Miss Batson will be sending out some information with some dates and stuff like that. We may not be able to record the whole thing, But it'll be me going over some more stuff. And guys, last year we didn't have a Q&A session. We didn't have an orientation session. I emailed everything out to everybody and they did fine. Y'all okay? So if something happens, you know, that you can't come, it'll be all right, okay? We would prefer if you did, okay? And that way you can probably meet some more people and talk to them and some of that kind of stuff, and potentially meet some more faculty and maybe even meet some of the upper level students, okay, who will be moving into their second year, which is their actual fourth semester, okay? So you could kind of talk to them, and that's one of the reasons we kind of do that thing, because most students have told me that's kind of helpful for them to kind of have network a little bit, okay? Now, before I move along, I did want to tell you I put my information up here. So my email is here, coxh@sandhills.edu. It's also came to you in the email from Miss Batson before, but something you didn't have was probably my cell phone number, and that's 910-585-0479. So, you know, feel free, you can write it down now, put it in your phone, whatever you want to do, 910-585-0479. And that way, if you need to get in touch with me, feel free. You can email me, you can call, you can text. It doesn't matter. I don't mind. You can call my office if you prefer, but my cell phone stays in my pocket pretty much all the time. So if you have something where you need to get up with me, like right then, okay? But remember, what do you need to get up with Miss Batson about? What are the topics that Miss Batson addresses? CPR, Castle Branch, immunizations, which includes TB and all that kind of stuff, right? And then what kind of stuff can you ask me about? Anything else? No, pretty much, basically. Anything to do with NUR 111. So the course schedule, the calendar, the books, the syllabus, you know, any of that kind of stuff. Content, uniform questions, all of that stuff you guys need to direct to me, okay? All right, so I'll leave it up here, and then that way if you can't see it or if you need to write it down later, it's up there, okay? So getting back to this, since we discussed the orientation, we already talked about immunizations, we talked about your CPR, we talked about the CNA, and that's listed in here we're talking about. But on the current program sheet that's there, you see it moved to June 2020. Do y'all see that? So for you guys, it's June 1st, 2019, because that's the program sheet you're working off of, okay? All right, and then we move down to what I mainly want to talk to you about. This is your actual program curriculum for the associate degree in nursing, right? Because you remember I said you guys are all listed in AGEN right now. So when you go into self-service, you're probably seeing lots of other classes that it looks like you have to do, right? And that's just because they have you placed in that until you come into the program, all right? So what you need to do is make sure that you've done all of these other classes, or that you're working on them, right? So let me kind of discuss with you what co-requisite means, okay? And make sure you guys are clear on that. So your first semester is going to be this fall, right? You come in fall of 2021, which is August of 2021, and you guys are going to graduate May of 2023, okay? So it's 5 semesters all in a row, August of 2021 to May of 2023. So this fall semester is coming up. So do you see these other courses that are listed with Nursing 111? It's Bio 165, it's English 111, and Psych 150. So guys, what those are termed is co-requisites, which means you either have to already have them done or you must be completing them with Nursing 111. Does that make sense to everybody? So if you have not already done Bio 165, English 111, and or Psych 150, you're going to have to take them along with Nursing 111 when you come in August. You guys were kind of aware of what that meant, right? Co-requisites, that's how that works, okay? Then when you move to the spring semester, which of course would then be January of 2022 for you guys, if you have not already completed ACA 122, Bio 166, and either English 112 or 111, you will have to take them simultaneously with Nursing 112 and 211. Do y'all see where I'm going? That's why we usually recommend getting as many of those courses done ahead of time as you can. Now, you can always do them earlier. You just can't do them any later, okay, because they're deemed co-requisites. So in the summer, what course do you need to take with Nursing 114? Psych 241, unless you've already done it, okay? Everybody clear on what I'm saying here then? Then the fall, you would have to take, and that would be fall of the second year, which is your 4th semester, okay? So that would be August of 2022 at that point. If you haven't done microbiology, which is Bio 275, or you haven't done your Soc 210, you would have to take those courses along with the Nursing 113 and 212, or do them ahead of time or already have credit for them. Does that make sense? And then that very last semester, do you see it lists humanities and fine arts elective? I want you to make sure you see down here at the bottom of that program, that humanities fine arts elective has to be one of those that's listed there. So it can't be drama 111. Do y'all see where I'm going? So it has to be, you know, either one of these arts, one of these musics, one of these philosophies, or this humanities 115, which is critical thinking, okay? So your homework tonight, after we address your schedule, which is going to discuss Bio 165, English 111, and Psych 150, because it's for my course, your homework when you go home is to go into self-service and make sure I either have credit for all these other classes or I've got a plan for when I'm going to take them. Do y'all see where I'm going? Because you don't want to come to the end and think you've got credit for Drama 111 and be ready to graduate, and then you can't because you've got to take a summer course. Y'all see what I'm saying? That's just ugly and hateful. We don't want to be there, okay? You're all excited and no. Okay, so let's don't do that, okay? Now, if you need help with this, what I would recommend you do is you contact your nursing advisor. So everybody in here should have one, right? Who's your nursing advisor? Do you remember? Okay, and you can look it up in self-service, so I'm glad that you said that. When you go into self-service, right underneath your name, there should be your advisor listed right there, okay? If you can't see it on self-service, if you guys, how many of y'all are not familiar with self-service? Okay, so everybody's been in there at least, okay. If you can't remember stuff, they have a tutorial right beside it to where you log in, okay? But when you go in, if you can't see your advisor, because every now and again I'll log in and I won't see an advisor for somebody, so that might be your case. You can always email me and just say, I've looked, I can't find it. It'll probably take me less than 5 minutes to look it up for you, okay? So don't feel bad if you have to do that, all right? But you want to keep up with your nursing advisor as you guys go through the program. And I would recommend, if you haven't met with them lately, that you go ahead and do that and have this conversation that we're discussing. That way you know early on, look, I'm good, I don't need anything else but nursing, and I'm not worried about it, okay? The other thing is, do you guys see in the second semester this ACA 122, this College Transfer Success? If you already have credit for ACA 122 here on campus, you're good, okay? Whether it was with Ms. Donadio or not. Now, if you have to take it on campus and you haven't already taken it, it must be taken with Ms. Donadio, and it must say for aging students or nursing students, like ADN, something like that. It's a specific section. I just want to mention that to you, okay? There is a way that if you have a bachelor's degree within like the last 5 years, you could actually contact Ms. Donadio and you could potentially get credit for by exam for ACA 122, okay? So if any of you guys have questions about that, you can stay after and I can talk to you about it or whatever, okay? Any questions about what a co-requisite course is? Everybody understands how this program sheet works, what courses fall in which semester, when you have to have them done? Yes, ma'am.
So would I have to take the ACA 122 from here, or is it okay if I'm taking it from another?
If you've transferred courses in from somewhere else, and I'm glad you asked this, as long as in your self-service it shows up as ACA 122, you're good, okay? Same thing for the Bio 165. If it shows up as credit for Bio 165 here at Sandhills, you're good, okay? But you guys are going to want to go back and look at self-service, confirm with your nursing advisor, and if you have to, because sometimes, usually when this happens is like Bio 275, I have some people who think they've had micro, and really what it is it comes in as Bio 175, which is a 3 credit hour class, and that does not equal Bio 275, which is a 4 credit hour class. Do y'all see where I'm going? So you want to go back and look at that in self-service, confirm with your advisor, and if you have questions, you have to go back and talk to the registrar's office, because they're the ones who give you credit for courses from other places. I have nothing to do with that, thank God. Okay. I would not want to have that determination. All right, so if you guys are all good with this, you know, that would just be homework I would tell you to do. Go back and look at the ADN program sheet, at the courses on the back, your co-requisites and stuff, and then, you know, set up a meeting with your advisor so that you know everything's good if you have questions, okay? That way you don't have any surprises or anything, all right? Now, go ahead and pull out your gold course planning sheet, and we're not going to fill the entire thing out right now, but I do want to do a couple of bits and pieces since we just talked about this. So do you see at the top where it says your ID number? If you know your SEC student ID, and it's about a 7-digit number, put it in there. If you don't, it's okay. But that's another part of your homework, is to memorize that 7-digit SEC student ID number, because whenever we have you fill out forms, that's usually how we identify you, okay? If we have to have some kind of number. We can't use Social Security numbers anymore, thank goodness. I don't ever want to know that stuff. We used to have to use that back in the day, thank God. So if you know it, or if you want to fill it out later, yes. Oh, yes, of course. Does anybody else need a pen? Everybody good? Okay. Go ahead and put your last name and your first name. For your address, guys, if you will, it's okay if you put your mailing address, but you might want to write to the side of it, like if you have a different mailing address than your street address, because sometimes we do look at that, like if we're trying to do clinical placements and we're looking like maybe you're driving from Lumberton, whereas I'm coming from Pinehurst or something, okay? Please give me a good telephone number, because when I get ready to register you guys, if I need to get in touch with you, this will be the number I'm trying to call if I have some kind of question or concern, or if I need clarification, okay? You don't have to worry about the curriculum code, so don't mess with that, okay? Now, once you get done with that, we're not going to look at the schedules yet. I'm going to talk to you about the bio, the English, and the Psych 150, okay? So we'll make sure everybody's pretty well done. You're good? Good? Everybody's pretty well finished with this part? Okay. So look at the section where it says Bio 165. Do y'all see that? If you've already taken Bio 165 and you have credit for it here at Sandhills, draw a line through it, because then that tells me you don't need that course. You've already looked at it. We've addressed it. I don't have to worry about it. If you do not have credit for Bio 165 here and you think you should, you need to go ahead and follow up on that with the registrar's office, okay? If you have not taken that course at all and you still need it, you need to circle the Bio 165. And then you need to circle which section you want to take, because I have seats set aside for Bio 165. And you remember that schedule that I had sent out to you, this one right here? And it discussed that in there about the bio, okay? So you could either pick from Thursday from 2:30 to 4:20, or you could pick from Friday from 1 to 2:50. So circle whichever one of those that you want. I have seats set aside for it, and I will put you in that section, okay? If you've already had English 111, do the same thing. If you've already had Psych 150, do the same thing. Just mark through them if you have credit for all of them, okay? Now, that being said, if you still need English 111 or Psych 150, I do not have seats set aside for those courses, okay? When you move along to the spring, they have seats set aside for Bio 166, and they just started saving seats for Bio 275. They also have seats saved in the summer for Bio 275, okay? So, you know, there probably is not a section for Bio 166 in the fall that does not conflict with my course, at least that I've seen, okay? So when I go to register you after you guys turn these forms in, and I get them from the people who didn't attend and that kind of stuff, if there's a conflict with a course that you're registered for, I will either call you or I will email you, okay? So we can have conversation about that, okay? So if you still need English 111 and Psych 150, it cannot conflict with my course. So how do you think I'm going to recommend that you take that course? Yeah, probably so. So if you haven't had it by now, online's probably what's going to work for you for English 111 or Psych 150. If you absolutely have to have a seated course for those two things, you guys probably want to get up with me so I can talk to you about the schedule and we can figure out something that's going to work. Because there are other options potentially if we need to do that, but we'd have to kind of work it out, okay? And that would be the same thing in the spring, because you guys know spring registration usually starts in like October, right? So there's a different course coordinator for the spring semester, and you'd want to speak with that course coordinator. Y'all see how it goes, like all along if you're having issues, okay? All right, and then clinical. I do not know whether or not we're going to be able to go to clinical right yet. Okay, and the reason for that is because in my course we usually do clinical in the nursing homes, and right now some of them may be letting us come back and others are not. Okay, I just heard from one today that we were hoping and they said no, so unless they change their mind like the end of July, we're looking at just one place potentially, and I got like 60, 80 y'all to rotate through there. So last fall, we did not do clinical at a site. We did it online. And it was okay. Everything was fine. It's going to be fine no matter what we end up doing with it. The students did well. The activities correlated with your classroom content, so they helped them actually better with the exams and all that kind of stuff. And when the students did go to clinical in January in 112, they did very well. They went straight to the hospital. They moved along with physical assessments, computer documentation, given meds. We didn't even notice any deficits, okay? So we'll make sure and make it work. I'm hoping we're going to get to go in some way, shape, or form. But it may be, instead of going all 11 weeks, it may be that we only get to go 2 or 3. Or it may be we don't get to go at all, okay? But the reason I bring this up, do y'all see it says can or cannot begin clinical as early as 5:45? If you can, write yes beside that. If you cannot begin as early as 5:45, write no. And the only reason I've even got that there was because one of the agencies that we went to clinical, they started at 5:45 with report. The one we're looking at hopefully going to is not going to be that early, to my understanding, okay? But still fill that in, yes or no. And it's not going to cause any issues for you or anything by being honest. I'd prefer you be honest. Yes, ma'am. I have no clue right yet. That one that started that early before was St. Joseph's, but we can't go there right now. Yeah. All of them are here. Where are you coming from? Yeah. So the ones we used before, we used Westfield and Sanford. We can't go back there right yet. We used St. Joseph's, which is like right here. We can't go back there right yet. We used Quail Haven and Pinehurst. We can't go back there right yet. The other one I'm looking at is Penick, and right now, are any of y'all in the CNA program right now this summer? So some of y'all are probably going there for clinical. That's the one we're in negotiations with because the CNAs are still going, and you know where Penick's at, it's right down there in Southern Pines. So that's probably where we're gonna go if we get to go. Other question? No. Okay, good.
With it being that early, if we can't go that early, would it make the day longer? If it's not from 5:45 to 3:30, if it started at 7, it would be later?
Nope. The reason I put that on your calendar like that and on this schedule when it says like clinical could be from 5:45 until 3:30, that's the earliest time to the latest time. Yeah. So, and guys, I'm gonna have to get creative if we only get one spot to go to. Okay, I mean really, we've been throwing out all kind of mess. So it may be that if we get to go to clinical on Tuesday and Wednesday, because that's our clinical days, so I'm going to make every effort, we have to keep it on that, okay? But it may be that one group goes in the morning and one group goes in the afternoon on Tuesday. And maybe I can run 4 groups on that day. Maybe I've got 2 floors, 2 there in the morning on 2 different floors, 2 there in the afternoon on that floor. You see what I'm talking about? And then maybe Wednesday. I don't know. We're going to have to see. We'll work it out, whatever it is. You know, and hopefully they will let us come, but we also got to be careful because we can't overburden them. Because then they're going to be like, no, y'all can't come back. That's too many people up in here. You know what I mean? So we'll see how it goes, but no later than 3:30, okay? If we did have to come back and ask that, I would ask for volunteers, okay? Because I've actually had to do Saturday clinical before, and I only took volunteers for that. And that's not an option right now, okay? If it was, because we do have an instructor who's willing to do evening clinicals, and so if we end up having to do something like that, I'd come back and say, please email me if you're interested in clinical from this time to this time. But I wouldn't make you do that, okay? Especially not first semester, okay? But you guys know that your clinical days do lengthen as we go along, right? So like second semester, I think it goes to like 4 or 4:30 or something like that. And the summer does that. And, you know, upper level, they're doing maybe multiple days instead of just one, or, you know. And we come back and talk to you every semester about the next course, you know, probably about a month before it starts or something. All right, and then that's it for now, okay? So I'm going to come back to this sheet in just a second because I want you to pull out the calendar. And let's look at the calendar and go through it. And I think that will help you whenever we talk about those sections. It will help you feel better about what I'm choosing, okay? So if you look at your calendar, does everybody see that the first day of class would be August the 16th? Does everybody see that? That's a Monday. What time is class from? 9 to 11:50, and it tells you what we're doing that day. And I'm going to be there with you. And of course, you're going to get tired of me because in the beginning I'm with you so much because questions and you know what I'm saying, all that kind of stuff. That day is most likely going to be in person, okay? And I'll let you know for sure coming up. But as a rule, our class is going to be on Collaborate. Did you guys hear me say that? Okay? With a few days on campus that I will let you know early enough in advance so you can plan for that. Does that make sense? But that first day, for right now, plan on it being here on campus unless I tell you otherwise. I'll send an email confirming one way or the other though, okay? Now, that being said, it most likely, and I'll have to keep up with you guys about this, I think I booked it with Steve already, but Owens. That's probably where I'll put it, is in Owens Auditorium, guys. Okay, do y'all call it BPAC too, or is that the whole facility?
It's the whole facility.
Okay.
It's the auditorium, it's the green front library.
Okay. So Owens Auditorium, most likely on the 16th from 9 to 11:50. And guys won't,
What date is it?
August 16th. Yeah, and I'm pretty sure, I think I booked it with him. But just so you guys will know, and if we have it in there, Chris, I may get up with you about recording it potentially, but I'll talk to you guys. If it changes, like I said, I'll confirm we're here, we're not, whatever, okay? But anytime we have class, you guys have a break at the 50-minute mark, whether it's online or whether it's in person. We always break at the 50-minute mark, okay? So at 9:50, you'd get a 10-minute break and come back at 10. Y'all see what I'm saying? 10:50, you get a break, come back at 11. So it's not like a full 3 hours. Y'all would have a heart attack, wouldn't you? I'm on a fluid pill, so I can't stand there for 3 hours anyway. So y'all would be like, where'd you go? We're just sitting here. Now, on the 17th, you have class from 9 to 11:50. Do you guys see that? What's your topic for that day? Assessment and thermoregulation. Who's teaching you? I am. And what exam is it on? Exam 1. So I try to be really specific on my calendar because you guys are just learning, you know, how to read the thing. And that's the hardest part about 111 is figuring out where I'm supposed to be, what time I'm supposed to be here, what day am I here, when am I on campus, when am I not on campus. Y'all see where I'm going? That's the hardest part, I think, of this whole thing, and then figuring out resources. Well, how do I even get to my books? Where am I going? Y'all see what I'm saying, okay? You will not have lab the first week. Do y'all see that? Look on Sunday, August the 15th. What does it tell you? No labs this week. So if you ever want to know whether I've got lab this week and what my lab focus is, you look on Sunday for that week. So look at Sunday, August the 22nd. Do you have lab that week? Yes. What's your lab focus that week? NA1 skills, including blood pressure, pulse, and respiration. You remember, and we already talked about that, right? So your lab starts the second week. Does everybody see that? Do you have lab the week of August the 29th? Yes, you do. What's your focus that week? Holistic physical assessment, vital signs, and caring. And it was a lot of ands, right? And. Now, the difference is on the second week, that's a CNA focus for vital signs. Does that make sense? Versus when you move to the week of the 29th, we've already covered physical assessment in class. We've covered vital signs and what the nurse does. Do y'all kind of see where I'm saying? And so you're moving along in what you're supposed to be doing, okay? That's where we're going with it. All right, so now let's go back up to that first week. Do you have anything on August the 18th? Not a thing for nobody because we don't have any labs or anything, right? What about August the 19th? Class, 9 to 11:50. What about the 20th? Class, 9 to 11:50. Everybody's good with the first week, right? You're probably here for the 16th. You're going to be on Collaborate the 17th, 19th, and 20th. Everybody's good? How many of you guys have used Collaborate on Moodle so far? Ooh, the last group I had everybody but one person. In here, nobody, huh? What was that? That was your question? Yes. So I'm glad we got to this. So we will send out directions to you on how to use Collaborate, okay? And the group last year, I had multiple students who'd never used Collaborate before, and they got savvy real quick. Everybody was there the first day because we did it online the first day, and they were able to follow the directions and stuff, okay? Guys, if I can do it, y'all will be fine, all right? But we'll send that out, and that way, but I can't open my course until the 16th. They don't let us do that here. So I'll probably open the course at like 8 o'clock that morning. So if you want to log in, but you know we're going to be here at 9 o'clock. But if you want to log in, or you can do it later that afternoon, like to prepare for the Tuesday. Do y'all kind of see where I'm going? But it's fine. And if you have questions about any of it, you can get up with us and all that stuff. We realize, you know, there may be some technology issues and some of that stuff. Sometimes when I have to teach from home, my internet connection sometimes, especially when it's raining, there's a storm coming up. So just kind of take those things into consideration. The good thing about Collaborate is it's always recorded. So if you have to miss class or something, you can go back and watch it later, okay? You'll get my syllabus probably towards the end of the summer as well, and it does say that, you know, we don't like you to miss more than 15 hours of class for 111. So if you're gonna miss something, it's always best to email whoever the instructor of record is for that day. So look at the 24th. If you had to miss class on the 24th, which instructor would you email? Yes, and you don't know her yet, but you'll meet them all on the first day. But y'all kind of see how that works, and it's better if you can kind of do it ahead of time. That way we know you're not going to be there or whatever. But we do realize things happen. Sometimes people sleep over, you have an emergency, or you know what I'm saying, whatever happens, okay? But that's the good thing about Collaborate, though. If it's recorded, if you've got a doctor's appointment, come back and watch it later. Or even if you were in class, you can go back and watch it later, you know? How many of y'all learn by hearing? A lot, yeah. So re-listening to lectures and stuff can be a really helpful tool. All right, so let's go back to that second week and let's look at how this works, okay? So on the 23rd of August, what time does your class start? 10. So there are some Mondays, guys, that start at 9, and there are some Mondays that start at 10. So when I give you your hard calendar, I would highly recommend printing this thing out, and you need to look at it, you know, I'd look at it every day, okay? Because I've had people, class starts at 9, they don't show up till 10 o'clock, and they forgot, and they didn't look at the calendar. Y'all kind of see where I'm going? And you can write down stuff on this or whatever. How many of you guys put your mess in your phone? Good for you. I can't do that stuff. You should see my calendar. It looks atrocious, the one that's in my office, because that's what I got used to doing in school, and that's how I have to keep up with anything. If somebody come in and stole my calendar, I would have a heart attack. So, and y'all might feel that way about your phone or something, okay? But whatever works with y'all. I'm not going to take up your calendar and say, where's your schedule? You know, we don't do that kind of stuff, okay? So the 23rd, you're there in class from 10 to 11:50. But when you pick your schedule, we're going to talk about that in just a minute. If you have Monday lab, that means you would have class from 10 to 11:50, but then you would also have Monday lab from 1 to 4:30. So let's say you live 2 hours away. You probably ain't going to be able to do Collaborate at home from 10 to 11:50 and get here for a 1 o'clock lab. Do y'all kind of see where I'm going with that? So it might be on your lab days, if we're having Collaborate class, you might have to come to campus to do your Collaborate. Do y'all see where I'm going with that, why I said that? So if you do have to come to campus, you could potentially go to the library, but you need to ask them, can I put in earbuds, or where can I go, because people are going to be lecturing, people are going to be talking and stuff. Or it might be that you're in the parking lot and you're accessing, you know, the stuff. You'll have to kind of figure that out and what works best for you guys. Did you guys also get that email that we sent out about the computer requirements? So you definitely want to look through that, and if you have issues with the stuff that Dr. Pfeiffer had put in there, you need to email Ms. Batson, okay? Because there may be things that we can help you with. We've had a couple of students who had real poor computer access, and they had some monies through that CARES grant, and they were able to help them with like a laptop or something like that, or maybe they had some of the students could check out or something. Maybe they had really poor internet service. I've got one girl from early consideration who lives like Ellerby, out past Hamlet and all that stuff, and she was like, my internet just sucks. So we sent her, and I think they were helping her. They had some resources and stuff. So the answer is always no if you don't ask. Y'all know that, right? So anytime you need help with stuff, I would recommend that you come to us. And that's probably one of the hardest things I have students being able to do, is coming to tell us that they need help. And I'd much rather you come and tell me so I know up front, rather than you just not being able to come to class because you don't have good internet. Y'all see what I'm saying, okay? Dr. Dempsey is one of the main ones who will tell you up front that he never wants anybody to not be able to attend Sand Hills because of money. Okay, so I know Dr. Pfeiffer talked to you guys about financial aid and all that kind of stuff, and we sent out a PowerPoint about it, and I know the deadline is passed, But you could still apply. You could still talk to Mr. Garrison over there in the financial aid office. Like she said, sometimes people choose to drop out. Sometimes people aren't successful for whatever reason. Sometimes that frees up some scholarships. Sometimes they find other money, out there. If for some reason, you don't get anything this year, please apply for next year, because nursing has tons of scholarships here on this campus, guys. Okay, so just keep that in mind. But that kind of brings up your schedule, right? So do y'all notice on the 17th and the 24th, you have class on Tuesday? Do y'all see that? Now, do you remember from that schedule, I said up here, Tuesday has class from 9 to 11:50 for the first 2 to 3 weeks. Did y'all see that? And then it's going to start following your clinical schedule. Now, there may be some special days on the calendar later on to where we might have class on Tuesday, or we might have class on Wednesday. But I can't have class on Tuesday and clinical on Tuesday, because that would mean you'd be in class and she'd be in clinical. I can't do that. We got to have everybody together. You see what I'm saying? So when we go through the calendar, it's going to make better sense to you, because do you have class on the 31st? No, that's when your clinical schedule starts. Does that make sense? Okay. So what about the 25th? Who would have lab on the 25th? Only those people who have Wednesday lab. Do y'all see that? Okay, so I'm just kind of having you look through this calendar. Does everybody see how the month of August is kind of working? So your first day of clinical would potentially be August the 31st. And that would only be for people who have Tuesday clinical. Does that make sense? If people had Tuesday lab, they would be there for Tuesday lab. But you can't have Tuesday lab and Tuesday clinical. Do y'all see where I'm going? Okay. Flip over to the September schedule. What about September the 1st? Who would have clinical on that day? People who have Wednesday clinical. Not a trick question, okay? And if you have lab on Wednesday, then you would have lab that Wednesday, right? Because it told you had lab. So you can't have lab and clinical on Wednesday. Y'all see where I'm going? And we're going to talk about the schedule in a second. Now, look at September the 3rd. Did you guys notice that the Fridays went down to 10 o'clock? And I said in my schedule that Friday you're going to have class from 9 to 11:50 for the first couple of weeks, and then it's going to change to 10 pretty much for the rest of the time, unless it's like a special day, and it'll be on the calendar. The 3rd is when I start working with you with pharm math and nutrition. So I'm pretty much with you pretty much the whole semester, almost every Friday, okay? And we'll come back and talk about that stuff more again later. What about September the 5th? What does it tell you on that date? No labs. So do you have lab that week? No, it's not a trick. There's no lab. What about the 6th? You're off. It's a holiday, Labor Day, right? Now, you will have class on that 7th. Do y'all see that? So just class. There's no lab that week. So that's one of those special days. And then on the 8th, do you guys see that it lists clinical experience on campus? No matter whether you have Tuesday clinical or Wednesday clinical, everybody will be on clinical on the 8th. Do y'all see that? There are 2 days like that throughout the semester. This is one of them, and that's on a Wednesday. The other one's in November, and it'll be a Tuesday. I tried to half and half it, okay? And guys, I'll send you this calendar probably by the end of July, so you'll know everything and you'll know the dates, and you can plan with your work and your kids and your family and all that, okay? Now, I wish I could tell you that that calendar that I send you won't change, but since I don't know if we get to go to clinical and all that stuff, it will be done to the best of my ability, okay? And last year I only had to make a couple of changes because since we couldn't go to clinical, we had to do our computer training in December so that when you moved to clinical in January, you went straight to clinical instead of having to go to computer training. Does that make sense? Because First Health, they won't let you do clinical until you've trained on that EPIC program. Any of y'all work over there at First Health? You know all about EPIC, don't you? There you go. You'll get more training. All right. All right, look at September the 10th. Do you guys see that says out of class assignment? That will be true. You won't be here on the 10th. Because we have something that faculty has to do, so you can already count on that day. It'll be things I've got an assignment. So if you need like a long weekend, there it is. And you had a long weekend the weekend before too, didn't you? You had the 4th, the 5th, and the 6th. Then you get the 10th, the 11th, and the 12th. You might need a break by about that time, right? Y'all are being very quiet. All right. All right, so do you have lab the week of September the 12th? What's your focus that week? Medication administration. What about the week of September the 19th? What's your focus? That's not a typo. The first week we usually cover like PO medications, we do like topicals and all that kind of stuff, and then the second week is when we get into injections. So like sub-Q, IM, all that. We found better outcomes by separating it out and hitting it 2 different weeks, okay? When's your first exam? September the 13th. So guys, it's like a month in. Plenty of time to prepare, okay? And I'm going to send out some stuff about your books coming up, and I'm going to talk to you about that in just a minute. There is one that's required that's called Test Success, and it has chapters in there that talk about good test hygiene. So how do you prepare the morning of, getting sleep, you know, all that kind of stuff. It talks about test anxiety, but it also breaks down the test question. What have y'all heard about our tests? They're awful. No. They're different than any test you've probably done. In the beginning, they're probably a little bit more similar because in anatomy, you may have went through and had to know the definition of something and pick the definition. Or maybe you had to memorize, was it 205, 206, 7 bones? I can't even remember how many anymore. But ours are more like you have to know the definition of what the word is in the question, but then you have to pick what you're going to do about it. So it's more like an application type question. So that book helps you break down the question or the STEM and pick out the key words and whether I'm looking for the right answer, the wrong answer, the best answer, whatever it is. And then it helps you break down the answers. So you can usually get rid of 2 of them and you're down to 2, and then how do you narrow it down? And it might be that all 4 answers are right, but there's a best one. Yeah, I know. So we'll send that out. So if you want to purchase it ahead of time, that would be the thing I would recommend purchasing ahead of time. I wouldn't wait to look at that book until that weekend before your test, okay? Your book bundle comes with a ton of stuff, and it's about $1,600 to $1,700. I know that's a chunk of change, but it gets you through pretty much all 5 semesters, okay, with a few other purchases here and there. The book bundle must be purchased at the bookstore. Did you guys hear me say that? Okay? Don't try to go piecemeal purchase it somewhere else because you'll end up spending at least $500 to $600 more. I had a girl who did that one year. She had to send it all back, wait for money to come back, then purchase it through the bookstore, and she still didn't have all the resources when she was trying to piecemeal it, okay? So the stuff that comes in that book bundle, when you go pick it up, you're going to pick it up and you're going to have like 2 little things and you're going to be like, I paid $1,600 for that. But y'all know when you put a code in, it loads a bunch of mess to your computer nowadays, right? So you get 6 e-texts, number 1, okay? So you've got your fundamentals book, your med-surg book, you've got your maternity peds, you've got your psych, you get your pharm, and you get patho-phys, all 6. All e-books. They don't disappear. When they update with a new edition, it automatically updates to a new edition, okay? It also comes with what we call PrepU, which is an adaptive quizzing platform. And it comes with all 6 of those books. So if you're looking for things to do for practice questions, you go in and you can pull it up by the fundamentals book, and you can pull it up by the chapter that we're doing, and you can take quizzes of 5, 10, 20 questions. And it's adaptive, so the better you do, the harder the questions get. Do y'all see where I'm going? And that's usually what we recommend to help you study, the Test Success book, but then these PrepU questions. And some of your instructors will actually assign you quizzes. I usually do that. I'll go through and pull questions that I know that are similar to what I've got on the exam. And if you go through and do my quiz, you'll be very prepared for my test, instead of just telling you go to chapter 23 and do practice questions. Now, you may get a little bit of both, okay? You can pick multiple chapters because in the beginning, if you guys look in August, you see it says we start off with assessment and thermoregulation, right, on the 17th and the 19th. So I will send you guys, if you like, because usually people ask me for this before the summer ends, I'll tell you what your first chapters are going to be out of your fundamentals book. And that way when you get your book bundle, because I'll send out instructions for how to load it, if you wanted to read ahead of time, you could do that. It's not required. You don't have to do that. How many of y'all like to do that kind of thing to get ahead? There's always folks, and that's fine, but it's not required. I want you to know that, okay? But that's up to you. I'll usually go ahead and send my PowerPoints out ahead of time too, because students like that kind of thing too, okay? But you know, that way you could go ahead and start practicing in Prep U even if you wanted to, okay? But you don't have to. The other stuff that comes in there besides the ebooks and the Prep U, it also comes with something called Lippincott Advisor, which is an online platform where you can look up medications, you can look up labs, and it also helps you with some of the nurse and diagnosis stuff that we'll cover in class, okay? Also in the bundle is a 1-year subscription to DocuCare, which is our electronic health record. So you guys will use that potentially in lab when you go in, because maybe you do a physical assessment and they have you document some pieces. And whether we get to go to clinical or not, we use DocuCare for clinical as well. If you actually get to go to the nursing home, you'll have to go home and document your physical assessment in DocuCare that you've performed on your patient. If you're just in online lab, then we'll have you document something in relation to whatever the activity was. Does that make sense? And then also in that book bundle, your skills videos come, and then your nutrition resource comes. So it's a lot of stuff in there, right? But whenever you go pick it up, it's going to be a couple of little things that are probably about this size, and you're going to be like, I just spent that much money for 5 little things, and what is this? How many of y'all like hard copy books better? Yep, me too, and I find that every year, okay? So I also do send out a resource to where if you want to purchase hard copy texts, and they're not required, that you can do that. And it has a picture, it has the ISBN, but you still have to purchase the book bundle because of all these other resources, okay? And I usually recommend to students, if you're going to purchase above and beyond the book bundle, if you want like hard copies, I usually say, we use the fundamentals book in the first semester. We use the med-surg book in the second semester. We use the psych book in the summer. Do y'all see where I'm going? That way you're not purchasing all of them up front unless you just want to, okay? So, questions about the book bundle? Where do you got to buy it from? Exactly, okay? And there are a couple of other required resources, and they'll be, you know, in the bookstore, you know, they'll have a list of all the stuff that's required, right? The other things besides the book bundle, you can purchase from other places if you want to, okay? So if you decide you want to buy that Test Success book from F.A. Davis instead, or Amazon or whatever, as long as you have the ISBN number and that edition, that's fine, okay? But I just want you to hear me say the book bundle has to come from the bookstore. That way you get the correct stuff, yes.
You said the name is Test Success.
Test Success, yep. And I'll be sending this stuff out hopefully pretty soon. The early consideration people are about to have a heart attack because I haven't sent it yet. But that's because we were looking at some of the resources and still negotiating with Lippincott. Hopefully, we're going to be able to go with a skills product that's free. And hopefully that will mean a reduction in your bundle price. But I haven't been guaranteed that yet, okay? Because they have a new product that they want us to try, and anytime we trial stuff, normally they give it to us for free, and it'll be for free for 2 years, not just for a semester, because we were making sure about that. We didn't want you to have to come back and pay it something else, you know. Now later on, just talking about those other purchases, because I said it gets you through pretty much 5 semesters, the DocuCare is only good for a year, and y'all are in here 2 years, right? So usually when you enter your senior year, you do have to purchase another year of DocuCare, which is about another $140, just kind of preparing. Along the way, they may have 1 or 2 more books that are either required or recommended or some of that kind of stuff, but it's nothing like what it is up front, okay? Uniforms, when you purchase those, they're good for the whole program, okay? Nursing kit, when you guys pay your tuition, that fee is embedded in that, and that kit gets you through the whole 2 years, okay? And then there's some other things along the way, like some VSIMs and stuff, but when you guys pay like your tuition, those fees are embedded, and then we give you the codes, okay? Questions about the book bundle or any of those kind of resources or anything that I've talked about so far? Yes. Yes.
Do we pay the whole 5 semesters up front?
No, thank God, no. I wouldn't have been able to come to school, would y'all? No, but it is, yep. And they usually, I think the last day to pay for the fall is August the 10th. Yeah, but you can check with the business office. And it probably lists it in your self-service too. You guys know you can pay your tuition through self-service too, right? If you feel comfortable with that, okay. Yes, ma'am?
Are we already being charged for that since we're already like signed up?
The cost should be listed there for you. Yeah, and it depends on whether or not you guys are like financial aid or veterans or WIOA, if you have other things that are paying for it and stuff. If you're paying out of pocket, then the best of my knowledge is due by August the 10th. But it should be listed what you owe in there. Has anybody went and looked already and seen it?
There's nothing in there. I don't think it's gonna load until we actually register for.
For nursing one of them. I feel like a fool. I haven't registered you yet, so there's nothing there. It'll be there soon. She was like, why ain't I seeing nothing? I don't know. Sorry, it's been a really long day today and the end of a really long week too. But I've already registered the early consideration people, so everybody's here, but maybe 1 or 2 students. So we're gonna get the recording out to them, and then they'll give us the schedule, and then I'll get you guys registered, okay? So hopefully we'll have y'all registered probably by the middle of July at the latest, okay? But I'll keep up with you guys, and you'll know because Miss Batson, my best friend, will send out an email that says you're registered for Nursing 111, and then you can go in self-service and see something. Yep. Now, if something comes up with you guys for veterans or financial aid or something, send me an email, because I had a young lady from Tuesday who said, I need you to send something to somebody letting them know that I'm really in the program, I just haven't been registered yet. So her financial aid doesn't go anywhere or something. I said, well, send me an email, tell me who I need to send, what I need to say, and then, so if you need that, let me know, okay? All right, so how'd you do with the calendar? Did everybody kind of understand how class went? Online through Collaborate, unless I tell you, you have to be here, okay? And that first day, August the 16th, let's plan on being here on campus. And I'll send an email, like I said, either confirming yes, confirming no, whatever we're doing. There may be a couple of other days throughout the semester when you will be here potentially for class, but I've got to kind of look at the days and stuff, because Dr. Dempsey would like us to be more on campus than we were. But guys, y'all are here for lab almost every week. And if we go to clinical, you'll be in clinical some, hopefully. If not, we might be online, and then we might be on campus a couple of days, like those special days. Do you see on that September the 8th that said clinical experience partially on campus? Last year, what we had to do is we had several groups here for 2 hours, and then they went home. Several groups were here for 2 hours, and then they went home. Do y'all see where I'm going? And we did the activity, and then you had to do some other stuff at home or something, okay? So that's kind of how that would work. But you know how lab works, you know what weeks you have lab based on what Sunday says, okay? And then when clinical starts and all that kind of stuff. Did that kind of help to go through that partial calendar? Okay, good. All right, so the last thing we need to look at then is let's come back to the schedule. So the first thing I need you to do y'all see the section that says NUR 111 HO1A? NUR 111 HO1A. I need you to draw a line through that, because that section is already full. And I had put that in the thing that I had sent you. You guys saw I put full right there, right? Okay. So there's only 3 sections to choose from, okay? And let me look at this with you, because I just want to make sure that you're clear on this before you fill out your sections. If anybody has to leave before I get done, you can certainly take this home with you, and you can give me a call if you need to do that. That's fine, okay? I don't want you to feel like it, because I usually end up going over a few minutes, okay? So the first section, the HO1B, you've got Monday, Tuesday, Wednesday, Thursday, and Friday. You guys know you have class on Monday, Thursday, and Friday every single week, right? Just by going through the calendar. You know that we have class sometimes on Tuesday mornings, and there may be a couple of Wednesday mornings, but it wouldn't be when you had clinical or something like that, okay? So if you're looking at HO1B, what day does it say your lab is? Tuesday from 1 to 4:30. Do y'all see that? So if you have Tuesday class, you would also have class that morning and then turn around and have lab at 1 o'clock. But it's what days are listed for Tuesday class on the calendar. But I just want you to be prepared for that, because you'd have to do both if it says you have Tuesday class and if Sunday says you have lab. Do y'all see where I'm going? So if class ends at 11:50 and you live 2 hours away, you're going to have to attend Collaborate here on campus to be at a 1 o'clock lab. Does that make sense? What day would you have clinical if you have Tuesday lab? You would have clinical on Wednesday. And that wouldn't start until September the 1st. right? Because that's what your calendar says. Does everybody understand this section and how this one works? Okay. Now, let's look at the other two. HO1C, that one, when do you have lab? Wednesday from 1 to 4:30. And when is your clinical? Tuesday. So clinical for Tuesday wouldn't start until August the 31st. Does that make sense? And there may be those 2 Tuesdays before where you're going to have class instead, okay? So just don't forget about that. But then you would always have your lab on Wednesday from 1 to 4:30. Does that make sense? Okay. Then, if you look at HO1D, your lab is on Wednesday from 9 to 12:30 instead, but your clinical day is still on Tuesday. Does that make sense? So was that helpful to go through the calendar first, just so you could kind of see how the days work and all that, and you could figure it out, and then you can look at your schedule? So now what I'd like you to do, you have 3 choices, okay? So whatever your first choice is, you need to go out to the side and put a number 1. Whatever your second choice is, number 2. Whatever your third choice is, number 3. So if you guys will go ahead and fill that in for me, okay? Are you good with yours? Okay, excellent. I figured you probably would, but yeah, okay. Yes?
Say circle English 111 if we have it.
Yes, yes. If you haven't had English 111 or Psych 150, circle those for me. And then, what's your name, young lady? Cameron, yes, okay. So what we might want to do is, do you want to take it online?
Those ones are registered for, I'm pretty sure.
You are, good, okay.
I had to drop I had microbiology.
Yes, you and I did email each other, that's right. So you should still be registered for those other 2, so you should be good. But I'll look when I register you, and if there's any issue, I'll let you know. Thank you, dear. Any other questions about anything? Are you guys all right? Now, the other thing I do need you to do you see at the bottom where it says hardships? Do you guys see that? If you have something I need to know, like I'm driving 3 hours to get to school, or I've got 10 kids, God love you, okay? You know, a single parent, you know, husband deployed, significant other deployed, y'all see what I'm saying, okay? If there's something you want me to know, nobody sees this but me. But if it's something I need to take into consideration as far as, you know, trying to make the schedule or something, okay? Now, the other thing is, if you have no preference, B, C, D, write no preference, just off to the side over there. And you're my new best friend. Because then that means I can put you where I need you. And then other people can go in the section that absolutely they have to have or something, okay? Now, don't feel like you have to do that unless that's true, all right? So be honest on here because it helps me and you, okay? All right, so I think we addressed your preferences. I think we addressed the co-requisites. I think we addressed can or cannot start clinical as early as 5:45, and I think we addressed the hardships, right? So has everybody pretty much completed the gold form? If you need to take it home with you or something, you can do that, and you can scan it and send it back to me later if you need to do that. That's up to you guys, okay? But make sure send me an email tonight letting me know that you did that, okay, if you don't turn it in, okay? Because sometimes I know y'all have to go home and talk to family or, you know, there may be something else going on. So let me look back through my handouts and make sure I've covered everything. We talked about the schedule. We talked about the uniforms. Dr. Pfeiffer did her presentation. We talked about the computer requirements. We talked that the financial aid PowerPoint had been sent out. The last thing that was sent out were those math handouts. Did you guys see that? So if you wanted to get started with other things, you could look through those handouts. It's just a refresher on like ratio and proportion and how to solve math and that kind of stuff. There are some things in there about military time. We do use military time, so you want to be, you know, kind of fresh on that. Some of the other things, there actually was the actual comp dosage practice test. Did y'all see that? And the answers. In October of my course, you have a comp dosage test that you have to take, and you have to make a 90 on it, but you get 3 tries, okay? That practice test you've had for what, about a week? It's not a trick. That's almost identical to the test. We go over all of that stuff in the course, okay? And it's in the course, so you can go back and find it, but we found better outcomes with math when we give you that stuff early. And one of your other required resources is Dosage Calc 360. It's like an online math resource, so it has modules where you work through and it teaches you, and there may be some practice things. And usually I just open it up and let you work and do what you want to do. Occasionally I may require an assignment, but guys, you'll find I'm pretty laid back. And I'm one of those ones who thinks that you know what you need to be doing, and if you don't do it, who does it hurt? Yeah. You know, so I try not to be real hard about stuff. You know, I will require things sometimes. You know, like those Prep U quizzes I said when I make them, a lot of times I just make them as practice. I don't give a grade for them or any of that kind of stuff. And then if you have time to do them, which I usually recommend, because if I give you a quiz and I say it's a practice quiz, there's usually a reason for it. I'm just saying. Occasionally I'll give you grades on them, just saying that if you did it, I'll give you 100. Because that encourages people to do stuff, you know what I'm saying, especially early on, because you've got all these resources that you're trying to use, so it kind of forces people to get into stuff, okay? All right, any other questions about anything else? You guys have been an excellent group. I think I've covered everything that I was needing to cover. Any burning questions y'all walked in with that I didn't answer? Yes? I would say it's up to you. Certainly if you're doing Collaborate on campus, you know, you're probably going to have that. If we actually come to class, it's okay if you do that. Mr. Waldrop, how is the service in Owens? Is that like something where they can get internet if they, yeah?
We have Wi-Fi and there's not even a password. You can just, that's called Flyers, you just click on it, it locks you right in, so it's pretty strong.
The only thing is there's not tables that come out when you're in there, so you'd probably have to hold it in your lap. Yeah, but you know, and if we're in there, it'll probably be recorded when we're in there anyway, since I can't record it like I do Collaborate or whatever. But yeah, it's not a problem to bring it with you if you want to. Not a requirement necessarily. Now they may ask you at times to bring your device to lab, because it may be that they ask you to pull up DocuCare or something like that and do your documentation or look at the chart or something like that. It may be that they ask you, you know, sometimes if we actually get to go to clinical or something. But keep up with us about that, because I know not everybody has a laptop, right? And I don't think she said you had to have a laptop. I think she said you had to have a computer, right? That had like a camera and all that kind of stuff. And one of the reasons for that, guys, is because we did have to do some testing online potentially, especially with COVID when we had people who were quarantining. Because we did have that sometimes. People who actually had COVID or people who were quarantining because we weren't sure or they'd been exposed. Y'all kind of see where I'm going? Now, in the fall, we did all our testing on campus unless it was that situation, okay? But hopefully, you know, things will work out. We'll be here. We're moving right along. Question?
The uniforms, if you buy them at Reed's,
Yes.
are they exactly the same as?
Exactly the same. Yep.
And they'll do the
Embroidery.
and the patch there?
So my understanding is the uniforms, whether you buy them from Reed's or the uniform store, they're the same uniforms. So they're both going to be the correct color, the correct style. They'll do the embroidery for you. But the patch, they don't put the patch on for you, but you can get the patch, right? Okay, but you'd have to put the patch on. And if you guys go back and look at that email that we sent, there are the uniform guidelines in there that I sent from the ADN handbook. It discusses that the patch goes on your left arm. I think it's like 2 or 3 finger widths down from the shoulder, but you can find it in there.
And the shoes, do they have to be leather or they just have to be wipeable?
Leather type. Yep. So I'm glad you came back to this. Your shoes must be white, leather type, closed-toed, closed-heeled, and they can't be mesh. And that's in that uniform thing that I sent out too. So if you guys haven't seen that, you might want to go back to that uniform. Let me pull up when I sent it. I sent it on June the 16th, and it has the uniform information sheet, and it has another thing on there that talks about the ADN handbook, dress code, clinical attire. That's the piece you'll want to look at, because it discusses the shoes and the type they have to be and everything. So my shoes would not be okay, certainly because they're the wrong color, but they're also mesh. Do y'all see that? Leather type has, there's no needle. Leather type, the needle won't go through them. Do y'all see where I'm going? Because if I dropped a needle, it could potentially stick my toes. That's why they're particular about that. The other thing is a lot of our uniform requirements actually come from the clinical agencies that we go to, and they may say, you know, the hair can only be this color. You got to have the tattoos covered. You can only have these kind of shoes. You see what I'm saying? And to bring up tattoos, right now they don't require that they're covered. Okay, that's a new change. Unless we go to an agency that requires it be covered. And First Health right now does not. They changed their policy. But Cape Fear still requires them to be covered. So if we go to a different agency that requires it, then your clinical instructor or course coordinator will communicate with you about that, okay? If we went to First Health, the only reason it would have to be covered is it says something like if the patient finds it offensive, then that would be the patient would have to say something to you. You would need to discuss it with your clinical instructor, and then we would deal with it then. Y'all see where I'm going? So I'm real glad about that, because before you'd see students walking around with big old bandages on their neck and it looked like we're trying to cover a hickey, or it looked awful. I mean, I'm just going to tell you, it really did. Big bandages and all up your arms and stuff. It was a mess. So, yes.
I got told for the uniforms that they don't have patches anymore, like the ones that we use.
Where's that from?
I went to the bookstore yesterday.
Yes. Reed uniforms. Yep. So you can get your uniforms from the bookstore, but they had the patches at Reed's, right? Because she talked to me about that the other day, and I think she said that they weren't able to carry them or something anymore. So if she told you they don't have them, you can get your uniforms from the bookstore, but you're going to have to go to Reed's to get the patch. Yeah. And I think I may have had that on that handout. I think I put it on there, but I can't remember. But that's what you'll have to do. Yeah. And the patch included. Oh, from the bookstore? Oh, okay, well, good. Well, if they'll do that and it comes that way, then that'll work. Okay, how many of the rest of y'all ordered from the bookstore? Or,
Order today, but nobody was there to take over.
oh, good Lord. What day do you gotta go back?
I don't know, I was just gonna go to Reed's tomorrow.
Okay, well, there you go, I don't blame you. The bookstore you can use financial aid at, Reed's you can't. Okay, so sometimes that's why folks, you know, but I know she had orders like early on, but I was looking and I was like, well, I got late consideration students. It's not any of those dates that you've given me. So I don't know, maybe that was part of it, but see what you find. Anybody else go to the bookstore? Were they told that? So it sounded like they told her from the bookstore that once you did your order, they'd put it on there for you. If you have any problem, let me know. We'll get it taken care of.
I didn't even know she was there. I just saw like another nursing student there with her, and I was like, oh, okay, so there's someone who can help me.
Good. When did you do that?
Yesterday.
You missed it by one day. She's like, darn it. All right, but I would just go back and look at that ADN handbook thing that I'm talking about from June 16th. We will send the whole handbook out also probably at the end of the summer, because we're in the middle of revising it now. So usually at the end of July we send out the whole handbook, and that way you actually have the whole emailed thing, and then I normally give you a hard copy the first day. Now I couldn't do that last year because everybody was online and we weren't back and all that kind of stuff. But I like for you to have a hard copy. That way if you need to take it to clinical with you or something like that, okay? All right, any other questions?
Do we need to sign this gold?
Yes, go ahead and sign and date it for me, and I'll come around and take it up from you if you guys don't care.